Hello students, welcome to today's class. I am Bernisha, lecturer from Emmanuel College of Pharmacy. Today we are going to discuss about an important topic from pharmaceutics, that is monophasic liquid dosage form. Monophasic liquid dosage forms are the liquid preparations which contains two or more components which is present in one-phase systems. The one-phase system is represented by a true solution, which is a homogeneous mixture prepared by dissolving a solute in a suitable solvent. The component present in a solution in a large quantity is known as solvent, and whereas the component present in the small quantity in a solution is known as solute. Next, let's see about the advantages of monophasic liquid dosage form. As monophasic liquid dosage form is a liquid preparation, it is easier to swallow, therefore it is easier for both pediatric and geriatric patients. Next, it facilitates the absorption of a drug which is faster than the solid dosage forms as it is already in a solution form. Next, it is homogeneous, therefore there will be a uniform dose than suspension or emulsions. And it is very simple and easy to formulate, and it can be administered by various routes such as oral, parenteral, enema for in rectal use, otic, nasal and ophthalmic preparations. Disadvantages of monophasic liquid dosage form. As monophasic liquid dosage forms are bulky, it is very difficult to transport from one place to another, and it also shows difficulties in storage conditions. Here we are using water as a vehicle in preparation of monophasic liquid dosage form, so it may prone to microbial growth. So we have to add extra excipients such as preservatives. Next, the storage conditions. As we have to store the monophasic liquid dosage forms such as syrups are in a cool and dark place, as the direct exposure of sunlight may undergo such chemical reactions known as hydrolysis. Next, the drug stability can also be reduced by hydrolysis and oxidation so that they have shorter expiry date than that of the solid dosage forms. And usually this monophasic liquid dosage form has high drug instability. Next, we are going to see about the classifications of monophasic liquid dosage forms. These monophasic liquid dosage forms are further classified into four types. They are monophasic liquid dosage forms for oral use, monophasic liquid dosage form for external use, monophasic liquid dosage form for special use. Here, for oral use, we are using mixtures, linctures, draughts, elixirs, syrups, etc. And for external use, we are using in the skins, that are lotions, liniments, collodions. And for the special use, we are using gargles, mouthwashes, throat paints, eye drops, eye lotions, nasal drops, sprays, gouge, etc. Here we are also using the monophasic liquid dosage forms as parenteral solutions. First is liquid mean for the internal administrations. Here we are going to discuss about the monophasic liquid dosage forms we are taking internally. First one is syrup. Syrups are the aqueous preparations which consist of 60% to 85% of sucrose with or without the flavoring agents. They may be of medicated syrups and non-medicated syrups. The medicated syrups consist of the medicinal substances that produces the pharmacological effect. Examples of syrups involves chlorpheniramine maleate syrup, chloral hydrate, etc. Next one is elixirs. Elixirs are similar to syrup, but they are clear, aromatic, sweet and hydroalcoholic solutions with or without the medical substances. For example, dexamethasone elixirs. Next is linctuses. Linctuses are the viscous, liquid or oral preparations that are generally prescribed for the relief of cough. Example, codeine linctus. In the last slide, we have discussed about the liquids meant for the internal administration. Here we are going to discuss about the liquids meant for the external administration. First, the liquids used in the mouth. The liquids used in the mouth involves gargles, mouthwashes, throat paints. Usually, the threes are used to treat the throat pains or throat infections and any other infections from in the mouth. First is gargles. Gargles are the aqueous solutions which consist of antiseptics and antibiotics, and it is used to treat the throat infections. For example, povidone iodine gargle. Next is mouthwash. Mouthwashes are also aqueous solutions which is used to clean and deodorize the buccal cavity. Next is throat paint. Throat paint is a viscous liquid preparation which is used for the mouth and throat infections. For example, phenol glycerin and compound iodine throat paints. Next is liquids instilled into the body cavities. Here, these liquids are instilled into the body cavities such as eyes, ears, nose, rectus, etc. First, we are going to discuss about eye drops. Eye drops are the sterile aqueous oily solutions which are injected into the eyes. For example, timolol maleate eye drops. Next is nasal drops. Nasal drops are administered through the nose to obtain the local effect. Here, we are used to treat nasal congestions and upper respiratory tract problem. For example, oxymetazoline hydrochloride nasal drops. Next is enemas. Enemas are instilled into the body cavities such as rectum and colon through anus for cleansing, therapeutic and diagnostic purposes. And the final one is liquid MONOPHASIC. It involves liniments, lotions, paints, etc. First is liniments. Liniments are the oily liquid preparations which is intended for the external application with the rubbing actions. Usually, it is used to relieve pain and stiffness such as from muscle spasms and arthritis. Next is lotions. Lotions is the topical preparations with low medium of viscosity. It is mainly used to moisturize the dry skin. For example, calamine lotions, baby lotions, and these lotions are applied without any rubbing actions. In this video, we are going to discuss about the preparation of liquids meant for the mouth. Usually, we are going to discuss about the preparation of gargles, mouthwashes, and throat paints. Here, first, we are going to discuss about gargles. Gargles are the aqueous solutions which is used to prevent or treat the throat infections. Here, they are usually available in the concentrated form, which has the direction of dilution with the warm water before we have to use that. We have to brought it into an intimate contact with our mucous membrane of the throat and are allowed to remain in contact with for few seconds before they are thrown out of the mouth. They are used to relieve soreness or mild throat infections. For example, phenol gargles, potassium chloride gargles, and etc. Here we are going to see the potassium chloride and phenol gargles as an example. We are going to see the preparation of these gargles based on the British pharmacopoeia. For the preparation, we have to take potassium chloride, patent blue dye, liquefied phenol and water to make it 1000 ml. First of all, we have to dissolve the potassium chloride in warm water and cool, then add the liquefied phenol to it. And the last, we have to add the dye solution of patent blue, then filter the solutions and make up the volume with water to 1000 ml. Next is mouthwashes. Mouthwashes are the aqueous solutions which are usually used to clean and deodorize the buccal cavity. They have antibacterial agents, alcohol, glycerin, sweetening agent, flavoring agents, and coloring agents. Here we are going to discuss about an example of sodium chloride mouthwash based on British pharmacopoeia. For the preparation of sodium chloride mouthwash, we have to take sodium chloride, sodium bicarbonate, peppermint water to produce 1000 ml. We have to mix the sodium chloride and sodium bicarbonate and dissolve it in peppermint water and make up the volume with peppermint water to 1000 ml. Then the last one is throat paints. Throat paints are the viscous liquid preparation which is used for mouth and throat infections. Here we are going to see about the iodine paint compound. It is also known as Mandel's paint based on British pharmacopoeia. For the preparation, we have to take potassium iodide, iodine, alcohol, water, peppermint oil and glycerin. With that, we have to make up the Mandel's paint with glycerin to produce 1000 ml. In the preparation, we have to dissolve the potassium iodide in water. After that, we have to add iodine in it. We have to mix both the compounds until it gets completely dissolved. After it have been dissolved, kept it in a place. Next, take a small container and add the peppermint oil with 90% of alcohol. Then transfer this solution into the iodine solution. Mix thoroughly so that both the solution get mixed thoroughly. After that, we have to make up the volume of 2000 ml with the help of glycerins. This preparation has to be stored in a cool place since iodine is volatile in nature. Okay, students, I hope we have learned about the monophasic liquid dosage forms, their advantages, disadvantages, classification, along with the preparation of mouthwashes, gargles, and throat paints. Let's see in the next video. Thank you.